We're excited to talk about a program that we really do believe is an example of the transformation in how we think about delivering health care to a community. Today we're going to talk about and explain to you all the Mobile Integrated Health and Community Paramedicine Program. And so when we talk about programs like this, it is critical to understand that we believe that in the state of Maryland, we have moved further and faster than any other state in the country in trying to define the value associated with the delivery of health care. And that value ultimately comes down to the impact that we have on people's lives. And this example today that we're talking about, Mobile Integrated Health and the Community Paramedicine Program, is a tangible example of where the power of partnership can actually be brought to bear for the benefit of the citizens of our city. Today you will hear about how this program came about, and I'll ask you to keep in mind some key foundational tenets that help drive this. Partnership is key. You will hear about the partnership with the city. You will hear about our phenomenal partnership with the EMS system, the Baltimore City Fire Department. You will hear about the partnership that we have with the regulatory system in the state of Maryland that oversees reimbursements to health systems. All of these partners were critical to allow us to create the program that you're going to hear about today. We are in this transformation in how we think about the delivery of health care, and moving from hospital systems to health systems means taking on the responsibility of the health of our community beyond the walls of our organization. And so while we are always going to also be focused on the delivery of acute health care services, today represents an example of how we think about the entire continuum of health care delivery. And when you think about how we've come across the idea of these partnerships and the importance that they play, my hope is that you come away with the notion that the concept of innovation and the concepts of partnership and the concepts of healthcare delivery and recognizing our most vulnerable citizens and their needs that go beyond just the delivery of acute healthcare services within the walls of the hospital are all the principles that help drive us to what we are here today to talk about. There is no question that many of these partnerships are critical. I want to make sure I call out very specifically the Healthcare Cost Review Commission, the HSCRC, was a valuable partner in believing that this concept could be brought to bear and actually demonstrate tangible benefit to the citizens of Baltimore. They have been, again, they were the folks who stepped up and believed in our organization, believed in the partnerships we formed, and were willing to stand behind the test of this concept. There's no question that the medical center has enjoyed a storied relationship with MIMS, the emergency medical system that is, again, unique in the state of Maryland. And again, we definitely leaned on that partnership as we thought about the innovations that you're going to hear about today. And then the support of critical stakeholders in our organization. No question, Madam Mayor, the City of Baltimore has been a phenomenal partner in helping us navigate how we think about the delivery of health care outside the walls of our hospital, and helping us identify and address the most critical needs of the citizens of Baltimore.
When I think about this program, President Perman, this is when I got the invitation to come here. The State of the Union is tonight. Amen. But I said I really want to be here because I have learned how important it is to reach people where they are. You really do. After spending 6 months in the hospital, and the mayor's heard me tell this story, when I was about to get out of I'd only been there a month then, a lady comes up to me and says, a fellow patient who had been in there 3 weeks, she comes up to me and she says, Elijah, I'm getting out today. And I said, oh, Miss Murray, that's so wonderful. And she says, and then she started crying. I said, why are you crying? She said, when I came, they had to treat me. They had to treat me. But she said, so I got the treatment, but I can't afford the cure. Oh, you need to tweak that. Yes. That's what this is all about. Another thing that happened to me in the hospital is I had a chance to, Madam Mayor, to talk to a lot of African-American men. Many of them had not gotten checkups over years. I mean, like 30 years. I mean, they hadn't, and now here they were. They came in for one thing and discovered they had a whole lot of other things, a whole lot of other problems, and in some instances, it was too late. This is about saving lives. That's why, that's what's so wonderful about it. And it's practical. It makes sense. So often we find in our country, we know the things that make sense, but we can't bring the people together to do them. And so that's why when you talked about all the parties coming together to make this happen, that's why this is so significant. Innovation. We are taking innovative steps to use the technology that we have available to us to make a difference in people's lives. And again, we are being effective and efficient. I'm hoping that this program will be a model for the nation. One of the things I love about our mayor is that she and I agree that we want the things that we do not just to be for us. We want to set a standard for the nation. And when you can bring care to people, 'cause you know what? Because they ain't gonna come to you. A lot of the folks will not come to you. And let me put a commercial in real quick for women. Y'all listen? The research has shown that most of us men get care because of women in our lives. Encouraging us to do the right thing, encouraging us to get the checkup, encouraging us not to look at that chest pain as indigestion. It might be a heart attack. Those kinds of things are very, very significant. And so, again, I think this is so important to Dr. Marcozzi and Chief Ford and all of our other partners and everybody involved here. Thank you. And so what have you done? What are you doing? Let's break it down to make it real personal. You're going to make it possible for somebody to be able to go to their daughter's wedding. You're going to make it possible for somebody to avoid a stroke. You're going to help somebody be able to deal with their high blood pressure so that they don't have to be sitting and getting blood cleaned. Come on now. All of those things go to the quality of life. And I cannot help, and as I come here, I want to thank this hospital for taking good care of my mother. My mother had a stroke 3 years ago. She died, well, as of today, she died a year ago today. And I will never forget this hospital. First of all, I was born here, and my 6 brothers and sisters were born here. But I will never forget when, Madam Mayor, when my mother was, she came here right after stroke. They were giving her physical therapy. And I'll never forget the nurses and the physical therapists were working with her, trying to get her to just lift her arm. Just lift her arm, Doc. So she's sitting in the chair. They didn't know I was in the room. And she's trying to lift her arm. And she couldn't get it up. You know, she's sitting in the chair, right? Her whole left side was paralyzed. And so then she kept holding her arm up underneath, raised it a little bit higher. Said, no, Miss Ruth, you just keep your arm up, but I'm going to let go, and then I want you to, you know, to keep it up. So she put it up again, and my mother's arm my mother doesn't even know I'm there. I'm sitting in the corner of the room. The next thing you know, she said, I'm going to do it one more time. She said, I'm going to do it one more time. And I know She said, I know you can do this. I know you can do it. And so she lifted it up again, and my mother's, next thing you know, Madam Mayor, my mother's hand kept going up. She let it go, and the hand kept going up, and she came up, and she came up like this, and she said, I said, whoa. And then she came back, trying to show off. Did it again. But then the moment came, and this is what this hospital and this system is all about. The moment came when she had done that. The therapist started crying. You would have thought she was at some funeral. And so I had to ask her, I said, why are you crying? She said, because if you've ever worked with a stroke patient, those kind of things are very, very significant. And she said, by doing what she did, she was saying thank you. She said, she said, I live for those moments. She said, this will make my whole year. But what is that about, Chief? Perman, that's about passion. That's about people who care and give about people. And so I'm so excited about this. And I want to thank people for coming together, making it happen, because you know what? We've got one life to live. This is no dress rehearsal, and this is the life. And we've got to make the very, very, very best of it.
Thank you, Congressman, and thank you all for being gathered here. And I'm sitting here smiling at Dr. Cozy because he was reminding me that it was 2 years and probably almost 2.5 months right before I got sworn in, and I was here, and we were talking about doing this. And I had such a big smile on my face because one of the things that people will know is that I believe in mobility. I believe in taking services to people. And I know I'd shared with many who serve on the board of University of Maryland Medical Systems about my desire to create not just this kind of medical unit, but the unit that we created, where I raised over $500,000 to create a mobile unit to go out to people in neighborhoods and communities to get them jobs. Because just like you said, even with healthcare, you know, so many people standing on the corners of our streets won't come to you. We have to go to them. And here's what happens with this. And again, Chief Ford, Dr. Perman, Dr. Suntha, David Marcozzi, thank you. Thank you, because I don't know if everybody realizes how many calls we get through the 911 just for folks who are asking for emergency services. 32% of the calls are for non-emergencies. This city has 620,000 people. Last year in 2017, we received 154,621 calls that resulted in more than 100,000 patients being transported to emergency rooms. And that's because people don't have the health care that they should, not enrolled into health care programs, use emergency rooms as though they're their own personal doctors. Mobile integrated health care, community paramedics. This new program will dramatically change the way we interact and connect with our communities. And just like the Congressman said, you know, this is another way of saving lives. And it is also a way of directing folks to the care that they really need. When we have these kind of public-private partnerships, and that's what it's all about, because the city can't do this work by themselves, the hospital can't do it by itself. It's how we're connecting with our fire department, with our paramedics, and making sure that we're providing the very best of services for all of us. This will transform the way we provide services, but it also is a proactive way of addressing these issues. The beauty of a mobile integrated healthcare environment is that it begins with a community needs assessment. And it's also an opportunity for us to utilize some of the technology that is out there. When I think about telemedicine and all the other ways that we can provide people with health care without them having to run into emergency rooms, that we're directing people to services that they need. This is a way to help people in their homes, in your neighborhoods, in your communities, but more importantly, to help us integrate health in a way that we believe is transformative. We also do believe that we are creating a system that others will follow because they'll realize the impact of this. And just like you said, Congressman, every time we do something, we think about our city, we think about our community, but we think about our state and the nation. We believe that the things that we're doing, whether people see it or not, are very transformative.
Distinguished guests and colleagues, I'm excited to speak to you today about the 2 new mobile integrated health programs that we think will improve the health of West Baltimore citizens and be a scalable model for our city and our state. Launched through novel public-private partnerships, these initiatives both began last year. The first is named Transitional Health Support. The other and second program is named Minor Definitive Care Now. I'll discuss in greater detail these programs and present some of our preliminary data. Before I do so, my shoulder-to-shoulder partner in this initiative, EMS Chief Mark Fletcher, and I would like to thank and recognize the Health Services Cost Review Commission and the Maryland Institute for Emergency Medical Services Systems for their strong support in making this project a reality. Additionally, we appreciate the advocacy and proactive leadership of Madam Mayor, Chief Ford, President Persinger, pardon me, President Perman. I just got you a new title, Keith. Congratulations. Dean Reese and all the UMB deans who have been very supportive in this effort. Dr. Brian Brown, my chairman of emergency medicine, and Mr. Keith Persinger, as they are helping find solutions to the health challenges of our city. The mobile integrated health programs we will discuss today are designed to reduce health disparities and assist individuals live healthier lives, just as the congressman said. Focusing on 2 areas of intervention, we ventured into 2 different projects. The first is around pre-hospital health care. The second is around post-hospital health maintenance. As an emergency physician, I see firsthand the challenges West Baltimore citizens face to stay healthy. I also see when, despite their best efforts, they become ill or injured. Social and economic factors and the lack of a sufficient primary care infrastructure contribute to a high rate of healthcare utilization, and as you heard from the mayor, high EMS services responses. A person's health is defined by many influences, illustrated well on this slide. Interestingly, healthcare contributes 10% of a person's health, while social and behavioral issues contribute much more. Understanding this, we developed impactful programs to address as many of these factors as we could. Our first mobile integrated healthcare, transitional health support, or for acronyms THS, began in 2018. The focus of THS is to help patients transition safely after their hospitalization to their home. Patients thought to have significant health barriers at the University of Maryland Medical Center's hospitals are invited to participate while they're admitted. After discharge, a THS field team evaluates this patient in their homes. This then team, which is staffed by community paramedics and nurses from Baltimore City Fire Department, assess the patient's needs, develop a plan to monitor, and then support their health for the next 30 days. Backing up this team in the field is a significant operations center staffed by community health workers, social workers, pharmacists, physicians, nursing. And they help ensure that the patient's health is maintained and the health challenges we identify are addressed for those next 30 days. There are many other innovative aspects of this program that are state-of-the-art. One example is the use of telemedicine, which provides instant video connectivity between patients and our providers. We continuously analyze data from our program to improve. For instance, we now know better, and we understand the health challenges of our patients in West Baltimore. These challenges include, and are illustrated on this slide, getting and taking medications, coordinating care between providers, getting to appointments, and obtaining food. Our program is doing its best to understand the impact on our patients. On this slide, we actually compared healthcare utilization 1 month prior to our program and 1 month after enrollment in THS. After enrollment, hospital use decreased and outpatient use increased, suggesting an improved linkage to primary care and community resources. Another benefit we are starting to see is the THS patients return to the hospital less often than similar patients who are not enrolled. In fact, from August 2018, we have seen a 21% decrease in readmissions from THS patients. To have a successful program, it has to be rooted in patient satisfaction. And our scores presently, since the beginning of this program, are 9.7 out of 10. Let me pivot now to the second program we've initiated in West Baltimore, and that's the Minor Definitive Care Now project, which began in October of 2018. This program augments routine Baltimore City EMS services. The Minor Definitive Care Now team, which is a community paramedic and a physician or nurse practitioner, provides care to patients with low acuity conditions on scene, avoiding ambulance transport and the need to wait in emergency departments for evaluation. Let's approach this from a patient's perspective. Mrs. V was on a city bus when it stopped short, causing her to fall to the ground. 911 was called to transport her to the hospital. Our Minor Definitive Care Now team arrived and offered her on-scene treatment, to which she agreed. Mrs. V, a diabetic, had minor injuries and was given a prescription for her pain and information to help her manage her injuries. During her evaluation, interestingly, it was noted that she had an elevated blood sugar. And from the scene, we contacted her primary care physician and got her a same-day appointment to potentially adjust her medications. Thus far, we have provided on-scene treatment for a variety of low acuity conditions, including digestive, musculoskeletal, and skin conditions. With a focus on quality, since its launch, no Minor Definitive Care Now patients have returned to an emergency department within 72 hours. Preliminary data also suggests that when Minor Definitive Care Now treats a patient, the ambulance is available to go back in service 20 minutes faster. Our patient satisfaction scores for this program are 9.5 out of 10. These innovative delivery models support health, not just deliver health care. Our aim is to help those who need it, when they need it, where they need it. These programs create a win-win for our patients, the fire department, hospitals, and the City of Baltimore, and even the state of Maryland.
Greatly, greatly important to me, the members of Baltimore City Fire Department, the individuals that are here, as well as the individuals out in the field that are making it happen every day. I am thankful for what they do and blessed to be considered their leader. I have been in the fire service for over 27 years, been a paramedic, had a lot of jobs. I tell my folks in recruit school, and I joke with them, I've done just about everything you can imagine doing. I've even been a band director. I worked for Chuck E. Cheese, and I was Chucky. But I will tell you this much. The reason why we get into this business is to take care of people, simply to try to make a difference in people's lives, simply to try to make their lives better because we were there. And when I was a paramedic, one of the toughest things I had to deal with was I felt like we were part of an assembly line where we just grabbed the patients, moved them to the hospital, went back in service. Grabbed the patient, moved them to the hospital, went back in service. Went back to the same patient, grabbed that patient, took them to the hospital. It felt like we weren't making a significant difference. Where we are now, and the direction we're looking in now, gives us an opportunity to make a difference out in the field. I have members in my department who are nurses. I have members that are paramedics, and Chief Fletcher, who has been spearheaded this program, who was drum major this program. When he put the call out for members to join and be a part of it, we had a deluge of membership when we told them what we wanted to do. People who are nurses and paramedics as well. And in their last training, I visited a couple of their trainings because they require extra training to be a part of this program. And I just want to tell you one little short spigot of what somebody said. They said, we went out to the patient's residence, and this is early on in the program, and we sat with them. The patient had a garbage bag full of medication, had a history of running back and forth to the hospital, had just gotten out. And after, I'm not going to tell you specifically about what they said the patient's needs were, but I want to tell you the last thing that they said to me. We fixed her. We fixed her. That sounds simple to you all, but to leave there with the satiety of knowing that you took care of somebody's needs and they did not have to go to the hospital because you were there, and they had a better quality of life because you were exposed to them. I don't know if I could put it in words. I wish I would have been in that position. So I'm so happy and I'm so thankful to you all. I'm so happy to be here and be a part of it. Thank you so much, University of Maryland Hospital. Thank you so much, Mayor.
Why was the university writ large so privileged to contribute? As you've heard, the university's pharmacists, physicians, nurses, social workers are part of the operations center, offering vital support to the patients and to the paramedicine team, providing guidance, connecting patients with resources, and supplying follow-up care and counsel, coordinating care, you saw that on the slide, in a way that keeps people out of the hospital and in their homes where they're comfortable. You know, we're very proud of what happens in this amazing facility and the other facilities in the medical system. Very proud, and they're essential, but they are actually the default. Where we want to provide care is outside these walls. As has been said before, you have to meet patients where they are. And that's what this program is doing. It's low tech, it's high tech, it's community based. It combines what we can do with our telehealth abilities, and it is a model that puts the patient at the center of the team. We know patients want help, as we heard from the chief, managing their medications. What did you say? A garbage bag of medications. You know how many patients are on 15 different medications? You try that when you have to manage 15 medications a day. They're on 15 medications provided by 6 physicians who too often don't talk to each other, and nobody sits down and says, here's the way you have to do this collectively. And as you saw, it's the #1 need of the patients. And so I thank Dean Natalie Eddington and our School of Pharmacy for leading this part of the effort, being an indispensable resource for patients and for the paramedicine team. Patients want help, as you saw by the data, coordinating their treatment. We are too often fragmented in our provision of health care. So I thank our School of Nursing and our School of Medicine for delivering follow-up care and showing how to better connect providers, not only to the patients, but to each other. Patients need help with transportation. They need help to and from appointments. They need stable housing. And as you saw, they need food. Doesn't matter how brilliant we physicians think we are. If you don't address those needs, nothing happens. It doesn't matter how good our care is. If those needs, those social determinants of health, are not met, So I thank our School of Social Work for making sure that patients are connected to the resources that really underpin wellness. I know Dr. Marcozzi hopes to bring legal services. We were just talking about that. And our School of Law certainly wants to be a part of this partnership. We're also assessing the need for oral health services, which I know the Congressman has been a champion of, and how we might bring our School of Dentistry into this program. So this is the way you take a university working closely with our great medical center and put into practice what we preach, what we teach. It teaches our students, the providers of the future, that people need a team-based approach to deal with these incredible obstacles between where they are now and being healthy.